My name is Dr. Arlene Chung, and I am here to tell you today why we shouldn't teach doctors how to be well. According to the latest national census data, there are approximately 900,000 actively practicing physicians in the United States. The research from Tate Shanafeld and his colleagues tells us that over 50% of those doctors are suffering from burnout. This means that there are 500,000 doctors out there who are emotionally exhausted, disengaged from their work, and feel as though nothing that they do matters. The rate of burnout varies from specialty to specialty, anywhere from 30% to 75%. And I'm sad to say that in many of the studies, emergency medicine tops the list at number 1. Burnout affects men, and it affects women, but it affects women more. The Physician Work-Life Study, a national survey of over 5,000 physicians, found that women have a 60% greater odds of burnout compared to men. We as women have unique challenges that our male counterparts don't have, like role strain in dual career relationships, a lack of mentorship and social support, gendered expectations from our patients, pregnancy, motherhood. Women physicians have a 3 times greater likelihood of dying by suicide compared to men. Every year, there are 400 physician suicides in this country. That's like wiping out an entire medical school. And the real number is probably much higher than that because of underreporting, because suicide is still something that is shameful rather than a problem that we should be addressing head on. And this isn't just a doctor problem. It's not a doctor problem. It's not a problem for our friends, for our colleagues, or for our families. This is an everybody problem. If we assume that each one of those 400 physicians worked an average of 240 days each year, and on each one of those days treated and cared for and served 20 patients, that is 1,920,000 patients who have lost care as a result of physician suicide. This is not just a doctor problem. This is an everybody problem. Burnout and depression and anxiety and substance abuse and suicidality don't just affect physicians, they affect our patients too. Burnout has been linked to lack of empathy, lack of professionalism, increased in self-reported and perceived medical errors, poor job satisfaction, and a desire to leave the field. Feeling burned out can seem to represent some kind of personal failure on our part. Like we should just be able to pick ourselves up by our bootstraps and get over it. Be more resilient, meditate, go do some yoga, go hug our kids or hug our dogs. But burnout is not a me issue or a you issue or a you issue or a you issue. And the consequences of burnout are not an individual problem. Burnout represents a failure of this system to provide us the resources that we need to provide excellent patient care. I repeat, burnout represents a failure of the system to give the resources that we need to provide excellent patient care. Medical schools do not specifically recruit for people who are predisposed to burnout. And in fact, medical students are more resilient than their age-matched peers going into medical school. So clearly something happens along the way that has nothing to do with our inherent predisposition to burnout or substance abuse or depression or anxiety or just being unwell. Which brings me to the main point of this talk. I'm a career educator. I spend most of my days working with medical students and residents, helping them to learn and become great emergency physicians. I enjoy teaching things, and I have spent a lot of time teaching medical students and residents how to manage stress, how to be mindful, and how to just generally be more resilient. And I'm sure I'm not the only one. I'm sure there are many of you sitting in this audience who have done or are doing the same thing. And you know what I've decided after all the hours and days and months and years of teaching wellness to doctors? That teaching wellness doesn't work. It doesn't work. If it worked, we would have solved the problem already, and I wouldn't be up here standing here talking about this. Collectively, we have been trying to teach doctors how to be well for the last 3 decades, and I would have expected to see some kind of impact by now. Granted, 30 years ago, we were focused on smoking cessation and counseling on weight loss, and these days we're teaching meditation strategies and how to recognize the signs of second victim syndrome. But still, I would have expected some kind of change. And I actually worry that all of this emphasis on teaching is actually a step backwards. I worry that we're spending all this time and energy and effort on creating wellness lectures and curricula and workshops, and it's actually just distracting us from where we should be focusing our efforts in the first place. I feel like wellness is this hot new topic in medical education, and I can't walk more than 50 feet without running into a new wellness program. But if teaching doctors was really the answer, then why are there 500,000 doctors who suffer from burnout? Why are there 400 physician suicides a year? And why are there 1,920,000 patients who are losing care as a result? This is not an insurmountable problem. And in fact, this is an imminently solvable problem. And we as a healthcare society have actually solved a very similar problem in the not too distant past. A problem that at first glance seems so insurmountable that no amount of individual teaching doctors seem to ever be able to fix it. In 1999, the Institute of Medicine published this report, To Err is Human, that not only reported that 98,000 hospital deaths each year were due to medical error, but it was also the first report that shifted the blame away from the individual. The committee who put together this report recognized that individual accountability, an individual's competence, their good intentions, and their hard work had very little to do with whether or not a medical error occurred in the first place, and held hospitals and departmental leadership responsible for making the system's changes to improve patient safety, with dramatic results. This shift from individual culpability to a redesign in systems thinking is exactly what we need to solve our current crisis of burnout. We have done it before, and we can do it again. Change is possible. It is possible, but we have to think outside of the classroom. We have to think bigger than ourselves, bigger than our programs, bigger than our departments, and bigger than our country. The environment and the marketplace requirements for success are there. We are living in a millennial age, and everybody is talking about wellness and work-life balance, whether you're in healthcare or not. And even if your C-suite doesn't totally buy into it yet, at least they've heard us knocking. And if you can convince them that their business bottom line is worth it, they will drive those organizational imperatives home. Those hospital-wide and system-wide changes will shape the microcultures within each department and improve the lives of each and every one of the individual providers. I worry that we have spent far too much time in the bottom right-hand corner of this screen. While it is super easy to convince people like me and like you that wellness is important, we all know people in our departments who eye roll at the mere mention of anything wellness-related. Sure, we can make them sit in a classroom and listen to a lecture on guided meditation, but I can guarantee that they are not going to change their behavior one iota based on that teaching. You can lecture somebody to death on the principles of good sleep hygiene, but you will have a much greater impact if you go to your department chair and advocate for circadian rhythm-friendly call schedules that will improve the sleep habits of everybody in your department, whether or not they buy into wellness in the first place. We can get there, but we can't do it by just teaching. So how do you even go to your leadership? What do you tell your C-suite executives, your hospital administration? What do you tell them? You tell them that the estimated annual cost of physician turnover due to burnout for an average-sized hospital group is $5,625,000 a year. That's how. You speak their language. You give them numbers. You give them data. There is a reason that Tate Shanafelt and his colleagues in many ways have probably done more to advance our mission of physician well-being compared to any other group because they've done the research. But they don't have to be the only ones. We can get the numbers, we can get the data, and we can do research. We can make a difference. When it comes to systems redesign, one of the most important things to understand is that the drivers of burnout and engagement are the same. You can either work in a department that runs like a well-oiled machine or a chaos factory. You can feel supported by your colleagues or totally hung out to dry every time a bad code goes down. You can feel as though you are making a huge positive impact in the lives of your patients or not. You can feel as though you have control over your life or not. And while some of these drivers are teachable, they're much more effective and we'll get the biggest bang for our buck if we use them to drive systems change. Whenever an organization starts to implement physician wellness initiatives, they follow a very predictable pathway from novice to expert, with a correspondingly minor to transformative impact on the individual employees. Unfortunately, most of the organizations out there are still at the novice level. There may be some awareness of the issue that physician burnout is a problem, and there may even be a wellness committee, but most of the interventions are focused at the individual level, such as teaching meditation or providing resources on exercise and nutrition. There are some organizations out there who are moving towards a better understanding of the drivers of burnout and engagement. These organizations are characterized by the presence of peer support programs and some attempt at measuring physician burnout. But it is not until you get to the competence stage that organizations really start to put their money where their mouth is. These organizations understand the business case for well-being and practice systems redesign based on the drivers of burnout and engagement. At the proficient level, organizations will actually start to align their key operational objectives with physician well-being. They have funded wellness programs, they train leaders in participatory management, and they have systems-level measurements in place to regularly monitor trends. And finally, at the expert level, physician well-being becomes a central component of the organization. These organizations will often have a chief wellness officer who is just as important as a chief financial officer or a chief medical officer. There are endowed, funded wellness programs that not only help that organization, but help other organizations as well. Physician well-being becomes a strategic imperative of the organization, and it creates a trickle-down effect that permeates through the entire culture of the organization. We can get there, and I know this seems so daunting, but we are well on our pathway towards excellence. We can get there one step at a time, but we're not going to do it by just teaching doctors how to be well. So what now? Should we just give up? Should we just stop teaching altogether? Of course not. Systems change like this takes years, and we have to do something in the meanwhile. So yeah, go meditate, go do yoga, go hug your kids and hug your dog, but never lose sight of the fact that simply teaching doctors how to be well isn't going to be enough to solve the problem. And if you do teach your students and your residents and your colleagues and your bosses that they should feel empowered to change the healthcare system that we work in. We will never get there by simply teaching. But I believe that if we teach, if we advocate, if we write policy, if we lobby, if we work in government, if we go out there and teach our future generation to become leaders in emergency medicine, that they can go out and change the world, that we can go out there and change the world. My name is Dr. Arlene Chung, and I believe that together we can open the door to a better future. Thank you very much.